Hey everybody, it's Dr. Justin at Fulk Chiropractic with another episode of Doc Talk. Today, doing low back pain day 4. I'm in a different location, so I don't have my drywall board, so I got a little cheat sheet in front of me instead. And I'm going to use a spine instead of written things on the board. So today I'm going to go through arthritis and degeneration. Arthritis, it's basically the deterioration, the breakdown of the joints. And we're talking about in the lower back specifically today, but it happens throughout the body. A lot of times when you look at the spine here, when you get to arthritis developing, you can get little spurs that grow off the bodies of the segments here. The discs will actually start to thin down. It's a degeneration of the entire joint complex here. What also happens is these holes where the nerve roots come out get smaller and smaller so they can irritate the nerve roots. And that's when you get the neurological development along with it. So just to go through some basics of it, the pain can really range. It goes from asymptomatic, no problems one day, to severe pain the next day. You don't know what you did, it just kind of happened. We have patients that come in a lot of the time that they wake up one day in severe pain and they think, oh, I think I've got arthritis. Well, you might, but you had arthritis yesterday too and you didn't have any problem at that time. So it's not just that it kicks in and now you've got arthritis and now you're going to have pain for the rest of your life. That's not how it works. You can be asymptomatic with pretty significant arthritis. And we'll talk about maybe some things to do to avoid that pain. A lot of times you get stiffness in the mornings. You've been sitting for a while, laying down for a while. You get stiff. It's tough to move around. But then you get moving around. You have some light activity and you start feeling pretty good. But then if you do too much, you start getting really sore again. So that's a pretty typical range with these things. Typically, it starts with a localized pain. You start to develop a pain in the lower back. You have that on and off. It can come and go for years. If it gets pretty severe, then you can start getting the radiating symptoms into the legs. Could be because those holes are getting smaller and you're irritating the nerve roots. It also can be because it puts extra stress on those facet joints that I talked about a couple of days ago that radiates the pain into the buttock and down the back of the thigh. So those different things can start to develop when the case gets more significant. Treatment options. Adjustments can do a lot of good for arthritic patients. You get that joint function restored and you get that mobility back and you can get those symptoms to go away. Spinal decompression therapy, doing a traction of those arthritic joints and taking the pressure off the discs. And then again, rehab exercises, stretching, strengthening, just getting active, exercise programs, those types of things, eating healthy. There's a lot of things that can be done to help it. Now, they won't fix arthritis. The arthritis is going to be there. So adjustments is not going to fix it, but it can help you gain some function, reduce the symptoms, and in a lot of cases can prevent it from getting worse. And that's the point with arthritis, is it's keeping it from getting worse. Expectations of care. In the first maybe 1 to 2 weeks, we expect mild to moderate improvements. You know, it's not going to most likely be gone, but hopefully starting to see some difference. You can do a little bit more. You're not as sore in the mornings, those types of things. And over the course of 4 to 6 weeks, seeing pretty significant improvement in a lot of cases. I've seen some really severe arthritis cases come to my office. By the time we're done working with them, they really don't have any symptoms for a while, and they can maintain that. So that's about all I wanted to hit on with arthritis and degeneration. Tomorrow, I was going to talk about this stuff today. I'm going to talk about that tomorrow for day 5, and we'll see you then. Until then, stay healthy.